The Centers for Disease Control and Prevention has confirmed the first severe human case of H5N1 avian influenza, also known as bird flu, in the United States. This zoonotic infection has raised concerns about its potential to become a global pandemic. The case involves a resident of southwestern Louisiana, reported as presumptively positive last Friday. According to Emma Herrock, a spokesperson for the Louisiana Department of Health, the patient is over 65 years old, has underlying medical conditions, and is currently hospitalized in critical condition with severe respiratory illness related to H5N1 infection. Due to patient confidentiality, further updates on their condition are not being disclosed. This marks the 61st human case of H5N1 in the U.S. since April this year. Despite this alarming number, the CDC has reassured the public that the overall risk of the pathogen remains low, with no related deaths reported in the country so far. The CDC's December 18 announcement revealed that the patient had contact with sick and dead birds in backyard flocks, making it the first case in the U.S. linked to such exposure. Among the 60 other cases this year, 58 were associated with commercial agriculture, including 37 infections from dairy herds and 21 from poultry farms. The sources of exposure for the remaining 2 cases remain unknown. California has recorded the highest number of infections, with 34 cases this year. All but one of these were linked to cattle exposure. In response to the rising cases, California Governor Gavin Newsom declared a state of emergency on December 18. While this severe infection in Louisiana is the first of its kind in the U.S., similar cases have been observed globally. For instance, in Vietnam, a patient diagnosed with severe pneumonia, sepsis, and acute respiratory distress syndrome succumbed to an H5N1 infection in March, as reported by the World Health Organization, WHO. According to CDC data, the U.S. currently leads the world in H5N1 infections reported to the WHO this year. The CDC has issued guidelines to reduce the risk of infection. People are advised to avoid direct contact with wild birds, infected animals, and their bodily excretions. Workers on cattle and poultry farms are at higher risk and should monitor themselves for symptoms. Properly cooking poultry and poultry products eliminates the risk of infection. Although unpasteurized milk from infected cows poses a risk, it is still unclear if avian influenza viruses can be transmitted through its consumption. This development highlights the importance of vigilance and precautionary measures to prevent the spread of H5N1, especially in high-risk areas. Authorities are closely monitoring the situation and urging the public to stay informed and follow safety guidelines.